So we're going to work on upper trapezius, and this is an absolute classic. An awful lot of trigger points, about 90% of them, match up with acupuncture points, and I believe, but I may have got the number wrong, I believe this is gallbladder 21. So along here, about a third of the way along upper trapezius, and in most people you will find an area of knotty tissue. So just to show you where the thumb is, it's here. I'm just going to press the tip of it in, there we go, into that congested area. Becca, how does that feel?
Really good pressure.
Yeah? Could it be a bit firmer?
Yep.
Okay, I'm just sinking my weight into the front foot there. Now I could have my hands round the other way, that's fine. Or I could go in with a knuckle. So there's lots of options. I think for me, the covered thumb works best, given the size of Becca's body, the size of my hands, etc. Experiment, find what works for you. I'm just going to hold that. Again, I can pulse it a little bit. Just drop my arm down there. Becca, can you gently press that shoulder up towards your ear? Thank you. So she's contracting against my resistance for a few seconds and let it go. And as she lets go, I can sink in a little bit further. I think we need to do that a couple more times when you're ready. And she's squeezed. I'm resisting the squeeze, so the muscle's contracting against me, and let it go. Okay, thank you, that'll do. And sometimes you'll find there's several points here. I'm coming down just a fraction. Ooh, how's that, Becca?
Yeah, that's more tender.
Yeah. So sometimes you find yourself following a trail. And now I'm slightly below upper trapezius. This is more Levator scapulae. Do you get any referred sensation from that, Becca?
Yeah.
Where's it going?
It's funny, I can't quite make it out, but it's around my armpit.
Okay. Fine.
Sort of going down that side of my body.
Thank you. So that's useful information, and it's like a signpost from Becca's body, which means at a later point in the treatment, I would give some attention to that area. It doesn't have to be straight away, but I'll just clock that for later. And she's breathing beautifully. I'm hanging out here, just inviting this to let go and release. I'm not going to force anything. Sometimes I use my own breathing just to encourage somebody to breathe out a little bit. Great, and I can feel a change in the tissue, it's yielding, it's softening. Just going to come off for a moment. And you can see how the skin has pinked up a bit, so a bit of a capillary flush there. Extra blood to the area, nothing to worry about. Could also work into the rhomboids. So this area here between spine and scapula, and again, covered thumb is a really good tool to use there. And you may find that there's several lumpy bits, trigger points, that are worth paying attention to.